So I am discussing about the third part. So third part of the artery, maxillary artery is 6. First is posterior superior alveolar artery. So it goes through the alveolar canal of the maxilla. So maxilla has an alveolar canal. Alveolar means gums. So alveolar canal. So it will supply the upper and upper molar and premolar tooth and the maxillary sinus also. So maxillary sinus is a paranasal sinus which is supplied by the posterior superior alveolar artery. Second is infraorbital artery. Infraorbital artery. This infraorbital artery goes through the infraorbital fissure. Orbital fissure gives the blood supply to the upper incisor and canine tooth along with the lacrimal sac and lower orbital muscles. A third is the greater palatine artery. So greater palatine canal enters to the greater palatine canal and gives blood supply to the soft palate, the tonsils, the palatine glands, upper gums. Now fourth is pharyngeal branch, palatovaginal canal. So it will supply to the roof of the nose, that is the ethmoid part, and the auditory tube, sphenoid sinus and auditory tube, that is the pharyngotympanic tube. Last, it is the artery of pterygoid canal, which enters to the pterygoid canal and gives supply to the auditory tube. This is also the auditory tube, the upper pharynx and the middle ear. So middle ear is also supplied by the artery of the pterygoid. And lastly, sphenopalatine artery. It will enter to the sphenopalatine foramen and gives supply to the lateral and medial wall of nose. This is the artery of epistaxis, sphenopalatine artery, that is the artery of epistaxis. So lateral and medial wall of nose and the paranasal sinuses. So this is the main third part of the maxillary artery, which is very important and difficult also. So this is all about the maxillary artery and its branches.